April. Let's get straight into the day's top stories. 2 staff members at Arwyp Medical Center in Kempton Park, which is east of Johannesburg, have tested positive for Covid19. A patient at the private hospital has also died. For more on this exclusive story, we earlier spoke to Newsroom Africa's Malungelo Boy, who was outside the facility.
Those 2 staff members are currently in self-isolation, and that they have been in self-isolation for about 2 weeks now, and that they were waiting to do final tests to see if these 2 staff members have in fact been cleared of the virus. Bandile Masuku did not give us a lot of detail as to how these 2 employees in fact contracted the virus, but he says he was given an explanation by the hospital as to how these 2 employees contracted the virus. But what we know for a fact from speaking to some of the sources that we've been talking to while working on this story is that these 2 employees had been working on a Covid19 patient, and some sources in this facility also telling us that these 2 employees, that when they attended to this employee, they actually did not have protective gear, the PPEs, and that they were quite exposed actually when they were working with this patient who we understand has since died. We've seen in some provinces really hospitals where employees have tested positive for Covid-19, the facilities would close down and there would be quarantine. But this hospital has not shut down at all. It is still operating. But what is currently happening is that they're using this entrance, which would be used daily by people, has been closed. Now they're using one entrance, which is on the right. But I asked Dr. Bandile Masuku as to why this hospital has not been closed, considering that there are some patients that have tested positive for Covid-19. And this was his response to me. Take a listen.
In terms of the portfolio of evidence that they presented their schedule, daily actual schedule that they do in terms of this disinfection. They've provided the schedule of actually fogging, and they've also provided a portfolio of evidence how they've separated the pathways and how they separated the wards. But it's something that also the prof is going around now ascertaining as the HOD of the department. But from where we are, I think they are doing it. It might not be enough, but we are hoping that they will improve as we go.
What's actually going to happen, because he's been given a portfolio of evidence really as to what the hospital is doing in terms of assisting staff in protecting them from Covid-19, what he's done is that he's asked some of his director generals to actually check whether what he has been told, what is on paper, is actually happening, is exactly happening in the hospital. So he's saying that you can believe what the hospital is saying based on what's on paper, but what he also wants to do, he wants to satisfy himself and also get a report from his officials that will be assessing and making sure that what officials have put down on paper is actually happening in this hospital is true.